Dr. Mythily and friends from Ahmedabad. It's indeed my great pleasure to welcome Dr. Mythily today to talk on a very interesting subject, which is music therapy. Today also happens to be the first day of Navratri. And in Gujarat, Navratri has a special significance. It is the first day of a combination of music and dance. And I don't have to tell you the beneficial effects of Navratri festival or the Navratri dance. We are all familiar with ragas in Hindustani classical music or Karnataka music. For example, Rag Deepak, which was probably sung, say by Tansen, and which, brought about the lighting of, the lamps, is very well etched in our mind. Rag Megh Malar, for example, creates the atmosphere, creates the background for a rainy kind of a situation. Or we look at Rag Hindol. These things are very well known to us. Sound per se is as old as, of course, the civilization. And music also is as old as that. Obviously, music, which is a combination of lay and tan, it is at the root of a variety of, things that we have seen evolving. Importance of music is very well known to all of us, but its importance in the field of bringing about healing is now being recognized increasingly. There is plenty of work worldwide that is now going on in the field of music therapy or medical music therapy, whatever name that you call it by. There are a number of institutions working on this. In the US, in Japan, in France, its effect, music's effect on various kinds of, maybe diseases is being investigated on a scientific basis. For treatment of Alzheimer's, for treatment of certain, maybe neurological diseases, for, for treatment of cancer, there have been many interesting studies. Now, all these things are, of course, not known to us in Ahmedabad. And therefore, I think, today is a very significant day because the first person in the field of scientific musical therapy is present with us. Dr. Mythily is a doctorate from University of Madras or University of Chennai. She has done a doctoral thesis in psychology as well as, musical therapy. She is attached with Apollo Hospital and she is the head of the department of music therapy. And obviously she has done monumental work in respect of impact of music for a variety of problems. Now there are two facets. One is, of course, the passive impact, and secondly is the active impact. I think she would be probably talking about it, but even on a passive plane, if you are subjected to certain kinds of music, certain kinds of notes, certain kinds of ragas, certain kinds of tans, there can be a beneficial effect. There obviously can be an involvement of the person himself, and he could probably be maybe singing some kind of notes or some kinds of ragas, and he could probably see what can be the benefits. She has been touring all over the country, and she has been giving her version of the work that has been done. She has also been publishing, writing a lot. She's a linguist, she's a writer, she's a contributor, and she, of course, is recognized as an authority in this particular field. I'm indeed very much obliged to her that she has agreed to come to Ahmedabad at such a short notice. As a lover of music, obviously I have had some pleasant experiences. I don't have to today maybe tell you, but being very fond of classical music, I have found that things like fatigue, things like tiredness, things like headache disappear if you are listening to certain types of music which could be pleasant, which could be maybe soothing to you. Ragas like Bhairavi, for example, have got some beneficial effects. This is very well documented. Or ragas like Kafi or Khamaj, they can induce sleep in the people who are having the problem of sleeping disorder. Now, all these things obviously are felt at an individual level by each one of us, but it is essential to put them into a scientific kind of a language in a scientific context. And that is what is in tune with the objective of this particular series of lectures, which is the new paradigm in health, that is illness to wellness and beyond. So it is perfectly in tune with that. And in light of the various kinds of problems that we are occurring now on mental, cellular, or maybe the molecular level, it is essential for us to understand how music can become an important part of our overall life for the sake of wellness and happiness. I would now leave it to Dr. Mythily to present to us her wonderful work that she has done. And before she takes on the stage, I would like to present a small bouquet from AMA in appreciation of her coming here.
Friends, Namasabhabhyam. This is very good, interesting. I'm really happy. I'm with all of this new set of people. My words hopelessly fails me now. Okay. Music therapy, before getting into that therapeutic medium, we people are very much aware. We are from our childhood listening music. Some individuals got the opportunity to learn, to be a part of the listener also, part of the studentship also, whatever it may be. If we are giving music in the early stages of exposure, it gives enormous benefits to the students as well as those who are exposed to themselves. First of all, the first introduction, we will come to the commercial first, then we will go for our experiences. Music is being accepted worldwidely as one of the soother or reliever of stress, whatever it may be, whatever we are having any problem. As a medicine, now it has been accepted. Three things. One, it is boosting as a medicine everywhere. Second, it has its own frills of what exactly we are using ourselves. Second, before getting into that commercialism, our country is full of traditional values. Can't we deny that? No one. We are full of traditional beliefs. Even the sound, the happiness, we have written something. Wellness to happiness. What is happiness? Can we explain anything before that? It is quite subjective. It cannot be explained in words. A certain thing which is much more happy to a person may not be so for the next one. For the same happiness which is elicited may not give the same life of liking happiness to the same person the next occasion. Even the Veda, it says, what is Ved? It is from one which you are learning, that is with, it is a root verb is with. From that we are learning, that is called Veda. That Veda, it says, we know Swargam or something, the abode of Lord Krishna, it's much more happy. How it will be? The Veda explains, ha, hu, how, ha, ha, only telling notes. It is telling in syllables, not in words. Okay, this ha, how, this is only telling the single letter syllables, the happiness will be like that. How the abode of Lord Narayana will be there, only single letter syllable. Even the Veda cannot able to explain in words and phrases. It is giving only single letter syllables, ha, hu, how. Kindly excuse me. There may be Vedic scholars, they may not permit, as a lady, I am not supposed to utter these words. I am entitled, not untitled to utter. Anyhow, for the sake of research, I have gone through this. Even the Veda is telling only single letter syllable, the question of happiness. Then how come we people, we cannot explain it in words. But anyhow, we will try our level best, come to a conclusion how the happiness will be. Then the Veda says, shall I move around? You want me to stay somewhere? I find it bit difficult to stay in this small place. Okay, then this way, when we are giving music, we are listening. How you are explaining, how you are listening. Music is a sound. Anyone can accept. It is only a sound, but it is a refined sound. Why? It has, now I am in thirst, I am in hunger. I will have to accept myself to speak. Is it not? Is it Even if I am expecting myself, am I now singing or speaking? Everyone will say I am speaking. Ga 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 ri 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 za za ni va ga ri. What I am doing now? I am singing. Even though I am little bit literally, physically weak, I am supposed to produce these notes in the same frequency. Then only it is considered as music. That is why it is music also a sound. It is a refined sound. That is the concept of my thesis. Everybody said, how can you prove? It is only a sound, na? You cannot say it is a music. Even sound will cure. Yes, definitely, of course. I too agree. But it is a refined sound. Whatever the physical condition of the individual, however he is physically weak, he is supposed to present the particular frequency of notes in the same wavelength. Then only it is considered music. It will have its own effect. That way I have proved it is okay. For that, the then it is the concept. From that we are deriving one conclusion. Music, where to where we can say, in the corporate medicals, there is two segments. One is sick industry, the other one is health industry. You and I, everyone, we fall sick, then only go and meet a physician. There are people, that is called sick, we get into sickness, go for the cure or ailment or some relief from that. Whereas there are certain people, they doesn't want to get into the sickness arena at all. They want to make themselves much more in good health. They will go for every 18 months MHC. You know what is MHC? Master Health Checkup. Then they are going for that. From that, is there anything going wrong? They want to make it set right. They are going some other thing. That is what the health industry, they want to maintain in good health. For that industry also, for the sick industry, music therapy does wonders. Even if we are falling into sickness, that music, for example, you can take in cardiology. There are many people, because of the stress, the so-called stress, it affects the most dreaded disease we are telling, the heart attack, heart disease. It is not so. The first thing, those who are getting to that sickness, they should learn to set at right what is we are, what is it. Everybody taking the stress into their stride. You put it aside. You try to learn, you keep the stress aside and see what it is. Make it, see the personality away from yourself. We people, we doesn't know. We want to take it everything into ourselves. Hey, Papa, he is coming late. He is not coming in time. If that car is drive is not coming. Everything we are putting here, that makes you into stress. You put it set aside. Try to learn what exactly it is coming. That way you can, I shall tell you at the fag end of my lecture how to come out of the stress, how to make it much more easy to face it. Then that stress industry, if you are getting into cardiac problem, that is the easiest way. That stress is particularly it affecting, that is we are unable to make the brain much more active to produce serotonin. Kindly put on the slides. You know, there are 3 neurotransmitters is available in our brain. Can anyone help me with that? It is serotonin for our freshness and alertness, for dopamine for muscle power, then for noradrenaline to go for the emergencies. Well, you have taken some food. It is naturally coming into, it is converting into serotonin. We people, we are getting into lunch. Immediately in 15 or 20 minutes, what we will be getting? Around 2:15 in the afternoon. A small nap. Even when we are very busy in the classroom, naturally we want to escape for 10-15 minutes. Why? In the sense, there is a serotonin of segment, the tyrosine and trypsin. The trypsin will cross over, immediately we get sleep. If it is not so, if the tyrosine crosses over, we will be much more happy and more brisk. That is what we want to take into, but many times, if tyrosine crosses over a bit early, thereby the brain makes the brain much more drowsy. We get 10 to 15 minutes of afternoon sleep. That's why in up countries they are telling afternoon nap is permissible in office. Because they are unable to come out of the tyrosine effect, they want to take 15 to 20 minutes afternoon nap. For that reason, we can come out of this problem by listening regular music. That's why I suggest the people to put music in their background. It helps to make much more serotonin, that is alertness, brain alertness possible. Then we know how much percentage, or we can go for number, we are utilizing our brain. Everybody says we are 10%, 25%. There are people say we do only 2%. It is a myth. We are not using all parts of brain all the time, everywhere, every time. If I am speaking, only my parietal lobe is working. If I am reading, my occipital is working. If I am singing, both my hemispheres are working. Why? In the sense, how you people will arrange things in your room? I will comb, then I will comb my hair, throw away my comb. I will come out of my car and put my car keys here. I will ask somebody, Are Baba, can anyone help me tomorrow morning to get me the key? If are we doing like this? There are people they are doing, they will make things, everything is haywire. Somebody has to be on their back. Somebody has to put him car key, then somebody has to give him the telephone mobile. If he is having two, three mobiles, so all the things will run. He will ring with one, they will go for it. It will make a messy everywhere. But rather, if you make an habit to keep things and arrange in a same place, it will do very good. That means for them, the right hemisphere is more dominating, doesn't want to arrange things in the order. They want to take, if you want to get, they will go on searching some paper and take it out. For people like me, if I am go on searching papers, I cannot do anything. So I will have to arrange chronologically, A for Ahmedabad, B for Bangalore. Like that I will arrange only, then only I can take it out. What is that I have spoken in Ahmedabad? That is logical presentation left with the left hemisphere. So we people has to make things logically arranged, chronologically present, then you aesthetically get into that with the right. That is what we should people, then only we can arrange things. That's the way what we should do next. Can we make it slide as a computer? Can I make it like this? I don't have even a single small paper, but it comes. That means the brain is arranging the slides in such a way, it is coming immediately next. So that presentation of things, that is how it has to be arranged. We are not instructing the brain, rather we can instruct the computer. Arey Baba, it go for the 11 should come next 12. Like that, but it is not possible. But our brain, that is why we are listening. We know what is 2 more slides. Next one. We know we have taken some food. We are taking every day some food. Sometimes it is much more spicy, sometimes it is much more tamarind oriented, like that. That affects our intestine. Like that, if you listen something, if you speak to something, that indirectly affects our thought process also. Everyone can accept this. If you get into some horror movies, what it happens? It takes some 2 to 3 days to come out of that. If you see some horror news, what it takes? Even some casual picture, it affects our brain. Even though we are unable to express what exactly it has happened, somewhat it is on the back of our mind, it is really nagging. So that way, whatever you listen, whatever you experience, it affects the brain as a vibration. These changes, how you do know? Everyone can ask me that question. It is observable. If I want to give a earphone and compile it with the scan, what are all the areas you are associating that can be seen in the computer. I can store it for my research purpose. If we are the happy brain, it hums. A stressful brain, how it will be? If you put cereals in the hot milk, how it does? It absorbs all the hot milk into that. Like that, if we are stressed, our brain will emulate those vibrations. That can be seen. It is a nice experience to see it in the PET scan. It will be much more colorful also. Then these changes, that's why music modifies behavior. It is as a refined sound, we can do wonders. The last one, the notes which are eliciting happiness, that can be listened every day. There is one more thing is available in our scriptures. All the 5 notes. That is, ascending scale is having 5, descending scale is also 5 notes. That does the wonder for healing aspects. Like that, many of the music are also coming into that. Next slide. Yeah. How the brain hears? All the science students of 8th standard can tell. We are listening through our ears, that is whatever it is, like that. These are for 8th standard. The music is being processed somewhere. Where it is? There is a special area which is available in our brain. Everybody is having that, but we are not utilizing it. That is a place called planum temporal. PT. Many people doesn't know, they dislike PT in the school. It is a physical training, they want to shrug out. But naturally it is a must, you should get into that PT. If you get into that PT, this PT will activate. The planum temporal, where the music is being processed. How? Now I am singing. It has some lyrics. Immediately what we will go for? This language, can we know? What is the meaning of it? Can we listen somewhere else like this? Some other persons are an exponent. He sing like that, she is not singing like that. That means the brain go on analyzing. That means you are not listening, you are go on analyzing. That is going on wandering. Sometimes there may be very good exponent, he might have sung that song in a particular, very beautiful way. Immediately, she is comparing. So go on analyzing, the purpose of listening goes off. Rather, if I don't give any lyric, the mind immediately, I am blocking some or 6 or 7 channels immediately. I don't give any lyric, only tunes. There are immediate, that too also I find very difficult. There are listeners, some elders. Madam, can you tell me what is the raga name? Why you are playing like this? Just put some music on the back. Why you are playing this? Why not the other octave immediately should be touched? Why don't want to take into? Like that they are asking so many questions, even though they doesn't want to take it as a medicine. Then immediately I am prescribing, you have some problem in I write some paracetamol, 400 mg. Can you ask anything, what is the component of it? Why should not we listen? Why should I take it after meals? I write everything, they are listening. Like that. So that way, if it is coming, you don't want to analyze what it is. Let the music flow into you from left to right. No need to retain. Let it go on the background. Just you make full note into you. You see the difference, what it happens. Just a few minutes of listening makes the difference. Okay, what exactly? This is a 5-note selection on the both octave. It has some 1 or 2 higher octave notes, 1 or 2 lower. Together we can say it does wonder. It releases. It is giving the tryptophan doesn't cross the barrier. Then it will not make you to sleep. That is the first point. All of you will be much more alert for the next 45 minutes. When we have. Sorry, sir. When we are taking this, how the brain process music? Can you tell? It is what we have taken some food. It is being processed here with the stomach's juices. Like that, brain is also having some neurotransmitters. It is processing the music in such a way. It is played by string instrument. We know this. We can learn. We are listening. That idea has to come into the mind of the individual. That music has been prescribed. The doctor has prescribed the medicine we are taking. We are getting to our healing. It heals. It will heal. That faith makes the much more difference. Rather, it is scientifically proved as a science. Whatever the mind, what we are having the mindset, it is what we are, we will be like that. So the particular wavelengths as a vibration, it makes you the correct level of transmitters to reach the brain and does the wonder. Because what we are doing today, what we are experiencing, what is our expressed behavior is the same. It is because of the brain, not because of our physics. There are some very good questions available in the medical field. Neurology is much more better. Without neurology, no human can survive. Hey, Ray Baba, keep quiet. Without cardiology, no such people will live. I should only make you to breathe. Then only your brain will act. Ray Baba, I should give you instruction to breathe. Then only you can. Yeah, you people are shouting. I will do on my own. The brain will go on thinking and wandering. Because cardiology is a person. He is also is taking the ball, putting into that. Is like just like a mechanic. But he is doing one very good aspect. When the vehicle is moving, he is putting the carburetor and making everything in action. Not as a car mechanic. He is switching off everything, then making the battery to work. But whereas the cardiologist is doing when the vehicle is moving. That's why cardiology is much more greater than neurologist. Some neurology will kill me if I tell this word. You are also a neurologist, you are telling a neurologist. Because when the heart is not taking the instruction, how clever you are, we cannot do anything. It should know how to breathe in between. That instruction has to come continuously, constantly has to come. So we are just listening. We'll get into the next slide. Yeah. Shall I get down? When we are listening, can I have any pointer? Okay. When we are listening, the brain, it reacts to the sound. How it is? There is an accident we have seen, or there is a much more happy moment. How we are experiencing, how we are interacting. It registers in our mind much more strongly than anything else. That time, this pink area, the amygdala, that secretes more energetic variations into that, thereby the brain registers much more faster. That episodes is still in our mind. There are many occasions. Can anyone tell me any of the unforgettable incidents in our life? We have so many. We have so many. Not because only the depressive area or sad moment or sorrowful incidents, even the many more happiest day we are remembering. Still it is vivid in my mind. My mind goes back to those periods. Where the other day, some other day, I have seen something. She is much more happy. Those things are registered because of the amygdala. It gives more instruction to the brain. Hey Baba, you react immediately. This can be given one illustration. When we are driving, some corporation wala is taking his all rubbish with the covered vehicle is going. Immediately what we are doing? Everyone closes our nostrils. That time also, that any severe stimuli will activate this amygdala. For example, we are very much in this pleasant air now. If immediately something unwanted, what exactly? The smell is coming. Immediately, are we telling the brain, Are Baba, hold your finger, hold it your nail? This instruction is not coming. In a fraction of a second, immediately our fingers closing our nostrils. That means the amygdala immediately reacts and makes you to be aware. Do not get into this. That time, if you see it in a PET scan, it will give light. Green color light will come on that area. This is moreover, it registers our behavior, our emotions, our activities. Like that. When we are giving music also, it acts. It happily hums. It makes you to think what exactly. That means the music experience is much more good. That registers. It gives, Are Baba, you are really happy. You get into that. Come out of this. Then, next slide. Yeah, this is much more. How we are tuning. That is when we are giving music. The yellow area, it analyzes the music in such a way, it is harmony. No, it is giving into that, going on, analyzing, then some other note is coming, go on. Then there is harmony, no, there is no rhythm. 2, 2, 2. 4, 4, 4. Like that, if you are giving the rhythm and harmony, that immediately it perceives and makes into registers. The scan photo, that area is being enlarged there. It gives that picture in such a way, Are Baba, it is dynamic, it is rhythm, the timbre. No, it is not voice, it's not instrument, she is singing. The lyrics, that there makes the difference. The lyrics, if you sing in your mother tongue, what it will be? Naturally, will enjoy. It has its own value. Even though I am speaking in English, if I am able to converse in my mother tongue with all of you, you can also follow the same. It has the wonder we can reap more benefits. That is the value of the lyrics. Then which octave it is going, whether she is singing in F sharp. No, she is singing a little bit G, I think. No, it's not so. Like that it is going. All these places, all activities it is going. If I am singing, naturally I go for beats. Then this comes, or all the parts of the brain is working when we are singing or when you are listening. Moreover, when you are listening, some other parts is taking rest. Some parts of our parietal lobe, the lower area, it's taking rest because it wants to be more active when some new things comes. The artist is singing something new. We are listening. We are maybe waiting. He may be singing one piece which is known to me. Are we not? We'll be waiting for that particular piece. So that area waits in some of the blue area, it waits. The artist may likely to sing one or two pieces, at least few tones which is known to me. Thereby it ready to wait to react for the situation. Then after some time, if it is a dance performance, what will be? I do not know anything about dance. I am a layman. What else? Very good, nice costume. Beautiful magenta and green goes. But her costume, too many jewelries. Like that also we can think. That also, it is one of the idea, because I am a layman, I do not know anything about dance. I don't know how many steps she is going, whether it is going into the rhythm, whether she is playing accordingly to that, I do not know. I am a layman. What I will be doing? I will be thinking. Visual perception gives me some pleasure. It is not a therapy. It is only diverting my ideas into that. Whereas when you are listening, going into the music makes the brain more active. When you are keeping quiet, all your brain are alert to listen. As a sound, it has its own vibration. As a sound, it has its own medicine. It does the wonder. Rather, when you are giving to the vision, it goes to the left. The occipital lobe will be more active. You want to be much more aware. When you are a bit sick, we are not aware. Tryptophan causes. Naturally go for your eyes closes. That's why everybody thinks in the auditorium, many of them are sleeping. In reality, it is not so. They are not sleeping. The tryptophan crashes. That as a psychologist, I know they are not sleeping. Even it happens in my classroom. I cannot call anyone, but I know that I will simply tell, few of the students have crossed their tryptophan to their brain. I am afraid they'll have to beg myself. Immediately they will come up and go for a fresh room and wash themselves and come back. That is the reason. They are crossing that. That way, the visual perception makes the difference. Then next class is much more scientific. We'll go for. Then these are the brains, that is neural connections, will have more than trillions. With the planum temporal, that I said before, it is 10 to the power of 11 into 10 to the power of 4 neural connections. I am poor at numbers. Because it is more, 10 to the power of 11, you see how many numbers, how many zeros will come. Into 10 to the power of 4, it is into million. It will be so many zeros. Through the entire room, the zeros only will be there. So that much connections will be there. Then with this, I will stop here and I'll speak about my research. Then we will connect together. There are two types of music therapy available. One is active form of participating. The second one is passive listening. That's what we are doing now. The active form of participation is helpful in the almost all medical areas, neurology, neural aphasia. There are people, they get sick after some accident. They cannot able to revive some of their memories. For them, if you give music in the lyrics form, in their mother tongue, they may able to listen, and some of the words will make them to tap. Some tunes will make them to move like that. That means that the movements will make them to come out of their bed and make that music will be a therapy for him. It is individualized. We cannot generalize those music. A music which is elicits some positive behavior in individual may not be the same for the others. It is natural. Like that, but whereas there are some limitations for the active form of music therapy. In the pediatric area, hyperactive children are there, autism, then Asperger's syndrome. For those children, active form of music therapy will do wonders. We can see those children acting to the music in such a way, whatever I am telling. So when the passive listening, it's doing wonderful for almost all areas in the sick industries as well as health industry. In the area, first we'll go for the pregnancy. It is in the gynecologic area. Do you say it is a pregnancy is a sickness or healthness? Yeah, it is a positive development of womanhood. One more development to the woman's life. So that way it is not a sickness, it is only healthy, betterment for the society, their family's development, like that so many things it can. For that, throughout the globe it has been proved the fetus listens sounds from outside from 21st week. But in my hospital, in Apollo, as a scholar, I have proved the fetus listens music from 19th week onwards. That means 134th day of their pregnancy, the fetus listens music. Everybody shouted at me, what nonsense, you are telling music. Yes, I said, music is also a sound, but it is a refined sound. Then everyone has clapped because I am a bit thirsty. I have to accept myself to speak. Even though I am thirsty, I should sing in such a way, then only it is music. Now I am speaking to you, I am not singing. That's why I am giving selected notes to the mother. There is a well-known verse in Veda, whatever the mother does during the pregnancy, the child observes. If she sleeps, the fetus sleeps. If she is active, the fetus is active. If she is ferocious, she is fighting with somebody, the child will also learn. We know this from our scriptures. Prahlad, you know, my research wing is having the name Prahlad. In Sanskrit, Prahlad means pra plus Rahalat. Whatever it is lying outside, it grasps. Pra ahladinchindi Prahlad. Even that is why Hiranyakashipu has put his son's name as Prahlad, because he wants to grasp everything. But Prahlad has grasped something other than that, against his father's wish. That is something different. That is God's wish. But that is the reason I have given my research wing name as Prahlad. It is grasping whatever good from outside. So by 130th day, or say by 19th week of pregnancy, I give music to the mother. I'll make them to listen. Nothing else. I have some couch, give the music, make them to listen. Just for few minutes on the day 1. Then for day 4, day 5, like that, I'll give 10 to 15 minutes of music. Every day, same time, same day. Thrice daily. Sorry, can I help myself? Sorry, very kindly excuse me. So that very sorry. The fetus listens music by 4 times a day or thrice a daily, like that. By 19th week, the fetus brain will be a plain one as a tabula rasa. Doesn't have any neural connections like that. We are also having neural connections like that, 10 to the power of 11 into the 10 to the power of 4 billion cells, neural cells. But in the fetus level, it will be very much plain, as known as tabula rasa, a liquid juice. No neural connections will be there. At that time, if I give the music, the fetus waits for the cells to develop. How it will be? I am moving now. The moment I am going out, my bag's handle comes out. What it will be? How it will? I will have to ask my driver to mend it and make things happen. That means I am waiting for 2 to 3 hours. Like that, the fetus will wait for 2 weeks. But only thing, I insist the mother to listen the music same time, same day. The mother is taking my instructions, she is listening. After 2 to 3 weeks, you say by 21st week or at the most 22nd week, the fetus sticks to the timings and reminds the mother by giving extra kick. You need not do anything. Thereafter, I will take care of myself. Today it is 7:20, na? I ask the mother to listen. She is listening today, tomorrow, day after tomorrow, like that. She is listening all the 3 weeks. On the 4th week, that is on 21st week of pregnancy or 22nd week, if she is not listening by 7:20, I don't come out, Are Baba, Mommy, Maji, put the music, we will listen together, we will enjoy. Nothing like that. I give extra kick. Reminds the mother by listen the music same time. Are Baba, keep quiet, do not disturb. I'll put the music. Like that, if you put the music like that, the moment the music flows into the room, the mother listens, the fetus keeps quiet to her surprise. It is an experience every lady has to be understood, not by giving information or writing something like that. It is an each individual's experience. It's motherhood is also a nice experience. It is one of the best one. Okay, this is happening from 22nd week. For my research purpose, 30th week of exposure is sufficient. Since the fetus is sticking to the timings, she cannot stop it till the day of delivery. That is why we are giving the same music in the labor room of my hospital. It is going on. Thereby, it ensures normal delivery. First benefit for the mother. First benefit for the mother as well as the child. Throughout the world, it is the benefit for the normal delivery to take place. If there is an unavoidable circumstances, something goes haywire, that time only we should go for cesarean. For every other actions, for 99.99%, if everything is going on normal delivery is most acceptable. First benefit. The mother do not develop any edema because she is enjoying the pregnancy. It's not an adverse, it is not creating any adverse effect. So it is getting into. These only 2 benefits for the mother. For every other benefits goes to the child. First thing, the child's prefrontal lobe enhanced. The child will be more active with the numbers, planning, cognition, perception, depth perception. Then one more thing, being with aesthetic sense, the right hemisphere is more active. If the child is girl 1, we can give him music and dance. Even the male can also dance. That will suit at the later stage. So the child, all sort of aesthetic activities related to right hemisphere, even computer designing, problem solving. It is limited. There, one thing you should remember, I am speaking to the genetic limitations. If the father and mother does not know anything about numbers, to that limitation, the child will be good at numbers. I cannot say the child will be a Ramanujam. There is genetic limitations is there. If I am good at number, my son or daughter will all be very much more happy with that numbers. If I am very much illiterate, I do not know how to write, even I am putting only thumb impression, how can I express my son to be a Ramanujam? Unless otherwise God, there is some mercy, some miracles happens. I cannot think my offspring will be an expert in that way. Even though that way he will be, to that genetic limitations, the child will be more expressed. All functions related to right hemisphere, number work, planning, cognition, depth perception. That means these are all available. How can we see, doctor? You are coming all the way, you are telling these things, how can we believe? It's a natural question. I'll give you illustrations. You have given music, the child has born. Since it ensures normal delivery, it is going on. The child has come out. On the 4th day, we are discharging the child. You are taking the child and mother home safely. The moment you put the same music in the room, everybody's notion, everybody will tell the child, if you want to check the child's hearing capacity, it will take minimum 30 days. Is it not? The old people will tell, because the cerebral fluid has to dry out on its own. We cannot wipe out. Then only we can find out. My grandfather will come and, this girl will hear. That is a time they will tell. But here on the 4th day I will tell, you put the music, the child turns his head, gives a friendly smile. Because you can find out that day itself the child is hearing. Because it's the same music, I know this. One more information we are giving, by 31st week, I'll ask the father to speak to the fetus. Appa, Swami, I am your father, you can tell. That's all. The mother need not introduce the father to the child. The moment he comes, I know, Are Baba, you are my father. You know. That on the 4th day itself I will tell. You need not introduce. That is the why in the sense the sound is being stored. One more thing, I am asking the mother to come and meet me on 32nd week of pregnancy to listen my voice. On the 4th month, I will request the mother to bring the baby to my room. I do not know the name of the baby. They will not be inviting me for the name keeping ceremony or like that. Hi baby, how do you? Just I'm doing this. The baby dives to me because they know my voice. They can, not because of my, that is, this is stored as a sound. The child reacts. These are all the benefits. This ability to be with the aesthetic sense persists with the baby for 84 months after the delivery. That means up to the age of 7 years. During the period, if you initiate the baby in any one of the aesthetic activities related to right hemisphere, whatever it may be. If you are a computer engineer, you give the same computer designing. The child learns ahead of the schedule by 4 weeks. I am a layman, I do not know how to sing. If I want to learn a new thing, it will take minimum 4 to 5 weeks to learn. The moment I left the room, naturally I forget. But whereas this child, if you teach, if you give the music, he learns in 3 days time. He grasps very fast. It's much more happy experience you can see. During this period, everything will be given because it helps them to come out successful in their academic. Our education system is like that. If I want to come up, I should not speak. My numbers, my marks list should speak. That is the way. If I am a forward, still worse. Even though I have numbers, it won't work. That is something different. That is, we are not coming here to speak about it. But it is something, what exactly? Because of this exposure, the right hemisphere more active, the child will be more logical and chronologically arranged. This is the first benefit for music therapy, that too in the early of pregnancy. It does wonder. It is a very good success. Almost every mother should experience this. They can make use of it. Then, second, anything else can we tell? Then, in the stress, everybody is having stress. First thing, anyone can define what is stress. Can help me with that, thereby I can come out. What is stress? Please. Disturbs you. That is nagging thought. Okay, anything else? Anything else? Pressure of work. Yeah. First thing. So these 2 questions we can answer. Pressure of work. What is? You should first make your work, or you belongs to your work. This is yours. It's your hand. Are you the same? You can identify with your finger? No. You are a whole person, entirely different from your work. Your work is a profession. You should have the personality difference. I am a father. How I should react with my son? It is something different. I am a mother. How I should react with my son? I am a doctor in a hospital. Can I act in the same way? To my daughter, I should give her much more restrictions. To my son, it's something different. To my patients, it's entirely different. I am a daughter-in-law to somebody. With him, can I speak like that? Shaking my hands? I should be like this. To my mother, I'll have to hold her chair and speak. To my mother-in-law, I cannot hold her chair and speak. There is a difference. It's a way of giving respect. To my father, I can hold his chair and speak to him. Sometimes I can hug him also. Can I do the same with my father-in-law? Maybe that is permissible, but I am not supposed to. There is a manners between. That is a personality difference. Because if it is something, that is what we are psychologists were telling. You cannot react to the same situation on same occasion on different people. We should be different. That is, you should see yourself something different from you. That is called role defining. I am a president somewhere. I am a treasurer somewhere. But I am a finance minister in my home. Something different, I can. That means my limitations in a home will be less than few thousand. I am a treasurer to some big organization. How I will be? My numbers will be in zeros, more zeros. So like that, the personality differs. That means your role has to be defined. You should understand what exactly you can come out of your stress. One thing. To come out of the stress, there are 2 types of stress. One is positive stress, the second one is negative stress. What is positive stress? I am working for my promotion. Only 2 seats are there. 3 people are competing. We know pretty well only 2 will be elevated to that post. One has to wait. We know pretty well who will be the rested person, who other 2 will be elevated. Anyhow, all 3 has to compete. We should put forth all our effort. All positive energies, all positive mindset, making things happen. We're much more grading, all sort of presentations, everything we are going. At that time, something will happen. We will not be elevated. That day we feel sick, we cannot attend the interview. Anything comes other way, we cannot make things. Like that, if anything comes, it prevents us our further elevation. What you will be? We feel that this day we cannot, it should not come. I should not go on there. I might be waiting here. Like that, we will restrict ourselves. Those who have been elevated, for them also this type of stress will be there. For them it is positive. Because the hard work they put forth has given some benefit. It is worth taking the risk, worth taking the stress. For them it won't do any harm. It will be those easy stress, too much back pain, too much neck pain, the head is shaking here, so we have some cramp here, like that. Whatever it may be, that stress will be get into the positive. That is called in German, we give U stress. EU. U stress is a positive one. It won't do any harm. The one person he has not been elevated, maybe for him it will be a negative stress. All the effort we have put forth, cannot able to elevate ourselves. That also he can learn it. He will wait for the turn. Ready to wait for the turn. Delay in gratification. These 2 principles will make him to come out of that negative stress. But when we are able to come out of that negative form, it affects our organs. There are people after the heavy stress of, you say for example the bank managers, giving loan, unable to collect the back money, then giving so many advances like that. For them, this works as a negative stress. It affects their organs. The first organ to be get disturbed is the pancreas. Because we are unable to come out of the emotion. The green area I have shown one, that affects. So for them we cannot able to. For that the beta cell has to be reactivated. There are particular nodes. And you can say that can be listened in mal counts, I think. If you listen regular mal counts, you can come out of that negative stress. Your pancreas will be activated. But that has to be individual pulse rate, body vibration has to be checked up, then only that raga can be given. Not exactly you would listen, you take all of them paracetamol, irrespective of your illness. Can I tell like that? If I tell, it shows my ignorance. So paracetamol may be a good medicine, it is a very good pain reliever, lesser side effects. But I cannot prescribe it to all the 200 people at the same time. All of them take 200 milligrams of paracetamol irrespective of your illness. No doctor will tell that. Like that, you cannot generalize the music. You can individualize, but it will give enough effect. Particularly, if you sit at least one session, you make your body vibration and pulse rate, let me check up, then I will prescribe. From that you can get on, then you can speak further. That will make the difference. So the first organ to get disturbed is a pancreas one. Thereby people get into diabetes sometime. Then because of the stress, there are people they get into depression. Is it not? Why? In the sense, they are unable to come out their thought process, go on nagging thought, thinking on the same line repeatedly 200 times per hour. It's a heavy toll on our brain. So that way, the music, which gives it is all the 4 segments is there, the stress relieving, just make a bit louder. The third piece is going into, that's why music is working in the rhythm and count, 4 into 4 into 4 into 4. All the 4s will be analyzed as a rhythm. Next one, next slide. Health wise, it is positive, physical as mental, whatever it may be, you should have the positive mindset. Whatever we are doing, we should do in the positive. It is possible. Man lives on hopes. How it is? We should have the positive mindset. We should continue to do further in the same line. That does the difference. Then healthy mind pays for the healthy body. And like that, healthy body is also pay for the healthy mind. Happiness is a subjective term, differs individually at different periods, but it can be felt and or experienced at different level and intensity. Next slide. Then we have seen two types of music therapy. What is that? Then what is music therapy? How it can be utilized? It is one-to-one, maybe, some very rarely it is group. It has to be presented systematically. Not like that, you listen this one, you listen this one, you go on listening, not like that. You systematically present a particular music for you treating your physiological ailment, what are related to the organic, the mind, the psychological background of the individual, and diverting his thought process. Thereby, you go for the required result. What is that I am expecting from you? You should come out of the stress. For this purpose you are listening. I give the music. For this ailment you are coming out. That particular result has to be, or first goal has to be set right. Go for that. That way you can get into the music therapy. That, for best example, it doesn't have any side effects. If at all we are not interested, simply switch off the system. Whereas when I am prescribing medicine, you cannot stop it as such. Unless otherwise, my instruction has been given, you stop this medicine, you go for new one. You cannot do that. But whereas in music, after all, if you are not interested at the most, simply switch off the system. Doctor, it's more than a week, I could not listen, I am very busy. That way it doesn't, Ore Baba, no problem. From that tomorrow onwards, you try again. But the result will take much more delay. Na? That this 7 weeks of exposure you are losing, that you will have to wait for the results some more time. For that I cannot help you, but you will have to get into. Like that, it has to be whatever it may be, results, whether it is related to illness or wellness or disability or inability, or you will have to get into that. That groove has to come first. Then you can reap results. Then we are all grown up. We cannot mend ourselves because we have crossed 30. We cannot learn new things. But I am concentrating on children more. If I make them much more good, the next generation is much more good. That is my aim. I want to be good for the children. Whereas if I am making them good, I am sure next 10 years we can see very good. No question of student malpractices will be there. So that way, educating purpose to enhance the concentration and memory. For one thing, I will give with regard to education, the right hemisphere, the language, music, all the three are same. RH, L and M are same. Why? In the sense, language and music is being processed in the same area, the planum temporal. If I am conversing in Hindi, I am conversing in English. What is the phonetic? It has its set of syllables, then only the language is there. Like that, it has its own set of syllables, music, then only it is music. Like that is the reason, if you want to concentrate, enhance yourself. What exactly? You put the music on the background, you read out. After some time, you stop the music, you can able to reproduce what exactly you have learnt. Because both are waiting. Music or tune, voice or lesson, it will wait. If you are giving, the one is keeping quiet, it will register all the music. Then you stop the music, all the read material will come out. So it is a very good exposure for the examination oriented person, students. Whatever you want to register, you put the music on the background. Even it is possible, if the music, same music has been presented, almost all red point will come as a page by page. To enhance the concentration and memory in children, it does wonder. Music makes a difference. Whereas even for coma patients, I give this particular raga in the concentration, which has only 5 notes. That does the difference. It makes them to cry out. From that patient, the tears rolling down. After some time, they will shake their toes. That means the brain is activating, come out of their stress, the over stress that comes little out. To enhance the concentration. Moreover, the more you speak, the early stages, we have given, with regard to pregnancy, we will continue. We are giving the music in the sense, if you give by 3 years, you start the music class. sing, vocal class. That means their brain is registering more verbal. The more exposure to music, the children will be more verbal. They will speak. They will chatterbox, you know. They will be like that. More information. If you are the normal child will giving only 100 words, the child will give 250 words. The more you speak, it gives the confidence. The more you keep quiet, it deceives you. We do not know how to speak. Where is the words? How would you go for the information? That means you have, the more you read, the more you can write. Is it not? If I write only one paragraph for a question, I read only, what is that I can able to reproduce? From only 2 sentences. If I read 25 sentences, at least I can write 10 sentences in the answer sheet. That means it will register, it will not able to bring out everything. Whereas music makes, it will make you ready, more alert. Pleasant tunes, it transfers good vibrations. Then music, that is what is cognition? Whatever we are doing here, we are giving meaning to that. That is cognition, perception, attention, then it goes for cognition. What is it? It is a pointer. I should perceive, then I should see, give the meaning, then I am cognitizing it, it is a pointer. Does it tell I am a pointer on its own? No, I know about it already. That is, I am giving importance to that. I am giving attention, perceiving that it is, I am holding it, then I am cognitive. That is, all the 3 together, previous experience, that is the memory, together it comes into cognition. So, music enhances your level of cognition, you can understand things very well. That way, music does wonder. Music has a positive transfer on many cognitive aspects. Almost no negativism is coming into that. Almost everything is positive only. If you learn music, non-musical goals are also achieved. If you learn music, your number work will be good. If you learn music, you can speak, you will become a chatterbox. That is a positive. In this world, you speak only, you can come out. If you receive everything, you will be deceived. So, if you take the music, it will be a non-musical goals of learning. Even if you learn music, the number work will be good. You can good at your languages. So many things will taken into. Then, so for patients, it works as an antidepressant. The quality of serotonin in the brain ascertains the expression of emotions and retention. How you are retaining the amygdala I have shown, it does the difference. Next slide. These are all the conclusions, very limited I have written. There are umpty number of we can come into. Music literally changes our behavior. First thing. Then, whatever the results we are giving, it is only the brink of the beginning. There are yet to come. One more thing, it has started to tell now. What is one thing? We are in the receiving end, we should only listen. Music and its relation to the brain. That is, we can say, these two have coincided. Music and brain has got friendship. That is only, it is already there. In our country, we are telling, my mind goes back to those periods in which history has no record. Because we are speaking about Ved. In Vedas, can you know the timings of it? When it has been written? Who has written? We are writing only small line. Though, winter wind, so not kind. We are writing our name under that. This is written by Dr. Mythily, so and so. She is such and such. That Vedas has been written somebody else. No, they don't have that. It doesn't want to. Can you know any one of their name? We are not sure of it. We tell so many names. We are not sure of it. So that period they are telling as a sound. In Chandogya Upanishad, there is one verse. You should listen this time. It is 7 o'clock evening. Sunset. After sunset, 1 hour has gone. You should listen this type of notes. This early morning, before sunset. What is the name of it? Pratakal. You should listen certain notes to energize yourself. It is evening. You should play Veena. It is sunset. You should, as a owner of the house, you are not supposed to play. You should ask somebody to play for you. Some male has to play the Veena. Some female has to listen. Like that, there are so many illustrations are there. Are we have written at this? It is very fast. It is being given by the Lord of Lords. So we are not sure. It is very far, very oldest available. So that way music changes our behavior. It is literally we can accept. But we are telling, that is why we are telling music and brain, it's work. It is together, now it has come. The results may likely to emerge very fast. It is more than 100 years we are working. But now slowly it is emerges, music and brain are together, it will do good. That is what in one more decade, before I cross 50, we can see much more wonders. That means it is sure I haven't crossed 50. So, okay. Anything else? Any questions? Can we wind? Or shall I tell some more?
Thank you so much, Dr. Mythily. Please, we'll have to stop the question answer because it's 8 o'clock and you can just meet her downstairs in case you have further questions. Friends, you'll agree it was a wonderful evening, so enriching for a very different kind of subject for this series of lectures from, illness to wellness. This is the 11th lecture of the series, Thank you so much, Dr. Mythily, for accepting our invitation and coming to Ahmedabad and giving us awareness, basic awareness about music therapy, and also giving us, further awareness about the finer aspects of musical therapy. We are fortunate to have a person like Dr. Mythily to come to Ahmedabad because she is, I think, the only person to do research and work in this area at this level, at a scientific level. Of course, as she said, our ancient wisdom, in Indian wisdom, has lots of this, but in today's scientific world, she's the person who is doing so much pioneering work. Thank you so much once again. Friends, thank you so much for attending in large numbers, and Mr. Dangayach also, million thanks for initiating, coordinating, and very working hard to continue and making this series very popular and interesting. Before we end, I'll request Mr. Dangayach to give Dr. Mythily a small memento on behalf of all of us.
Thank you very much. Thank you very much.
Thank you, friends, and wish you a very good evening.
Thank you all of you. Shubh Shayam.